The next one is the combined oral contraceptive pills. These contain both estrogen and progesterone, and they are taken also at a specific time at certain times of the day. What they do is that they prevent ovulation, and then you take one every day. Any woman at all can use it, just that you have to bear in mind that you would need to use the medical eligibility criteria to be able to rule yourself out or rule yourself into taking this contraceptive method. Return to fertility is immediate. If you stop in this cycle, when your next cycle begins, you can get pregnant. The good thing is that it does not interfere with sex. The woman can use it without anybody's influence. She can use it on its own. She has command of when she wants to take it, and it can be stopped at any time without needing the healthcare provider. It's easy to obtain, it's easy to use, and it's available in almost every shop or pharmacy. We have two types of the combined oral contraceptive. We have the 28-day pill, and then we have the 21-day pill. It's essentially the same thing, just that for the 28-day pill, there are 7 pills that are inactive. The 7 pills contain iron. And then after the 21-day, you take the 7 pills to kind of build your iron up so that you don't get anemia. But the 21-day pill, it doesn't have the non-hormonal pills. So when you take it, you wait for 7 days before you start the next cycle. But for the 28-day one, you keep on taking it every day. After day 21, you take the 7 inactive pills, then you start a new pack on the next day. You may have irregular bleeding, you may have lighter bleeding than normal, you may have heavier bleeding than normal, sometimes no monthly bleeding at all. Then you have the dizziness, the nausea, sometimes vomiting, you have breast tenderness, you may have weight change, and then mood changes as well. The good thing is that it prevents you from getting pregnant. There are certain cancers of the body that these contraceptive tablets taken would prevent you from getting it, such as endometrial cancer. It can also prevent you from getting ovarian cysts. It can also prevent you from getting pelvic inflammatory diseases, the symptomatic ones. It can also, since your menses are more regulated, you will not get anemia. And then sometimes they are used for women who have polycystic ovary syndrome. It controls their menses, so they don't have other symptoms such as hair on the face, and then it also reduces the pain of endometriosis. When a woman is taking these contraceptive pills, she's more prone to something we call deep vein thrombosis. That is when clots form in the veins of your legs. And then when care is not taken, these clots can travel into your lungs. It can block your lungs from using their oxygen, which is very harmful to you. You can get a stroke and then you can die. So that's why the medical eligibility criteria comes in, so that if a woman is at risk of this, we do not give to her. One thing we must bear in mind, that these contraceptive pills, they do not build up hormones in a woman's body. So the woman do not need to take a rest when she's taking it. It must be taken every day if you need it to work, and it must be taken at a certain point. It does not affect the woman's fertility in any way. Whenever you stop taking them, then you can get pregnant. It doesn't cause birth defects. It doesn't change a woman's sexual behavior. It doesn't collect in the stomach. When you take it, your body is able to utilize it, and then it goes away for the next day to come. And then when you are pregnant, it doesn't disrupt your pregnancy.